It seems like more and more people are having crowded teeth nowadays. Was it always like this? I mean, it seems like more and more people now are getting crowded teeth, and the rates have actually been going up. This systematic review and meta-analysis was showing the worldwide prevalence of malocclusion. Malocclusion is basically another word for having crooked teeth. They found that the worldwide prevalence for malocclusion was 56%. Now, this will vary depending on the area. So certain areas will have a much higher malocclusion. So they found that Africa and Europe were the two highest areas of malocclusion, followed by America. Now again, it depends where you're looking, because in my practice, I would say at least 75% of my patients suffer from malocclusion. And that's being conservative. The number is probably higher than that. Now when it comes to having not perfectly straight teeth, like even a little bit of crowding, I would say about close to 100% of people have that, if not in the high 90s at least. Now, if you look over the last few centuries, the rates of teeth crowding has been going up. Now, why is that the case? Well, the only explanation is that our jaws have been getting smaller. Because when your jaw is not big enough to hold all your teeth, then your teeth are not going to come in the right place. Your teeth don't just erupt in erratic positions for no reason. Your teeth will actually try to form in the right position, but if there's no room, that it can only find a crooked area to come in. Now, this also explains why our wisdom teeth do not come in the right position. According to the American Academy of Oral and Maxillofacial Surgeons, 90% of people will have at least one impacted wisdom tooth. Now, an impacted tooth is basically a tooth that is blocked. So again, if your tooth is crowded, it'll come in a weird position. But if it's impacted, it might not even erupt at all. For example, if your wisdom tooth is horizontal, then it's not going to have enough room to upright and come in the right position. Or even if it is vertical, it might still not have enough room to come in at all and just stay dormant underneath your gums. Now you might think that this is just normal or just your genetics working and causing these problems with your teeth. But it wouldn't really make sense for our genes to cause these problems where our wisdom teeth constantly have to get extracted. Now if you look at any skull from over 1,000 years ago, you'll see the exact opposite. Almost none of them had any crooked teeth, and all of them had their wisdom teeth come in the right position. Now, how was this possible? There was no such thing as orthodontics or anything back then, and they all magically had straight teeth. Even Stanford evolutionist Richard Klein, who is a top expert in our species' fossil records, has said he's never seen an early human skull with crooked teeth. Now, the thing is, it seems like it wasn't a change in our genetics at all that caused these changes in our jaws. All the evidence instead points to a change in our environment. Specifically, these are things like what we eat, how we are eating, and where we are living. So one of the biggest changes is our diet has become softer and softer. Literally, the foods that we have been eating have become so soft that they don't require as much chewing. Our ancestors used to chew food for about 4 hours a day. Can you imagine spending 4 hours out of your day chewing your food? But what happens is if you don't spend as much time chewing your food, then you don't trigger these stem cells in your jaw. These stem cells are what trigger our jaws to grow forward and wide. And when they grow in this forward and wide direction, that's how we get enough space for all of our teeth to come in. But after industrialization, we started really refining a lot of our grains and we started making foods become a lot softer. But the thing is, this also causes other problems as well, because this has also affected our breathing. Because now that people's jaws have started growing narrower and narrower, people's jaws have also started hanging open more often. Ideally, our jaws should be closed at rest. Our lips should be closed, our teeth should be slightly touching, and our tongue should be resting against the roof of our mouth. Not just the tip of our tongue, but also the middle and the back third of our tongue. This is what is considered proper oral posture, and this will also help stimulate the stem cells to expand. Because when your tongue is resting against the roof of your mouth like this, then your roof of your mouth will again grow in that shape of your tongue, in that U shape, and it'll grow wider and forward. But instead, if your tongue is against the floor of your mouth and your mouth is always hanging open, then again, your face is going to grow in that vertical, elongated, narrow direction. Now again, this will affect our breathing, because instead of breathing through our nose like we're supposed to do, then you're going to be more likely to become a mouth breather. Because when your tongue is against the roof of your mouth, it is literally impossible to breathe through your mouth. Try it now. Try putting the middle and the back third of your tongue against the roof of your mouth and try breathing through your mouth. You won't be able to do it. But when you have this proper oral posture, then it forces you to be a nose breather. But I would say nowadays, most people do not have this proper oral posture. And this will also help explain why most people have crowded teeth, or other malocclusion problems like an open bite or a cross bite. Now, these changes in our jaws will also make it more likely for people to get allergies or asthma. And part of this also happened when we started moving indoors, because our ancestors, they lived a lot of the time outside, but then recently we made that shift to indoors. Now, I'm not complaining about living in a house that has AC and a heater and a nice bed, but these homes that we live in also made it more likely that we're gonna be around dust, a lot more than we would if we lived outside. Now, this unnatural amount of dust will also contribute to these asthma and allergies. So in a nutshell, these changes that have happened in the last few hundred or 1,000 years really have affected the way that our genes have been expressed. They haven't really affected our genes themselves, but they have affected our phenotype. Our phenotype is basically the expression of our genes. So these changes have not allowed our genes to express fully. Not all evolution is for the best. And this evolution of us having our smaller jaws goes beyond just having crooked teeth. There's also a lot of diseases that are associated with smaller jaws. These are things like heart disease, eczema, lower IQ, depression, ADHD, Alzheimer's, and sleep apnea. Now, what can you do about it? Well, if you're an adult and you have crooked teeth and you want to fix them, really the only way to do that is by getting some sort of braces or Invisalign. There are other clear aligner companies out there now, not just Invisalign. But no matter what, make sure you're at least going through a dentist or an orthodontist. Do not do something like Smile Direct Club or something that is not overseen by a doctor. And we know that having straighter teeth and having a wider jaw now is not just for aesthetics. It's also gonna help with your breathing, like we talked about. If you have a wider jaw and more space, then you're gonna have a better airway. And you're gonna be less likely to have a lot of those diseases that we talked about. And also you're gonna be able to breathe a lot better. This is really important for when you're sleeping, because if you have something like sleep apnea, then you're gonna be basically choking yourself all night long. But having straighter teeth is also important for your oral hygiene, because when things are straight, they're easier to clean, they're less likely to build up plaque and bacteria, so that means less gum disease. It also means less likelihood of having gum recession, because sometimes what happens is if your teeth are really crowded, then you can have something called traumatic occlusion, where your bite is hitting one of your front teeth really hard and it's causing that tooth to get some bone loss and some gum recession. But if you straighten that out and make your bite more even, then it can really prevent those issues. It can also help other lesions called abfraction lesions, which are basically these lesions that form on your gum line. The reason that you can get these lesions is because, again, if your bite is off, or if you have been grinding or clenching your teeth, because that spot that is right by your gum line kind of becomes a weak point. And then over time, whether it's because you've been brushing really hard or you've been drinking acidic beverages, those areas get weaker and weaker, and they're more likely to either form a cavity or have some sort of erosion take place. Now, if it's your child that you're worried about, then luckily there are more measures that you can take. So number one is encourage your child to breathe through their nose at all times, and also ensure that they have this proper oral posture, again with their lips closed, teeth slightly touching, and tongue against the roof of their mouth. Now, sometimes what happens is you or your child might have a tongue tie. A tongue tie is basically this attachment that is from the bottom of your tongue to the floor of your mouth. If that attachment is too short, then it's going to be really hard to maneuver your tongue, and it's also going to be really hard to keep your tongue against the roof of your mouth. So a common sign of a tongue tie is if you stick your tongue out, then it forms this V-shape in your tongue. Really, the only way to fix a tongue tie is by doing a tongue tie surgery. Luckily, this surgery is very simple. All it is a dentist or a specialist will typically take a laser to that attachment, and it will kind of clip that and make some more freedom with that tongue. Now, one thing to note here is if you or your child gets a tongue tie surgery, they will probably get some tongue exercises as well. Now, make sure you do these tongue exercises, because if you don't, then that attachment on your tongue can regrow and scar. So it might actually make it worse than before you get that surgery. But if you do those exercises, then it's gonna make a whole lot of benefits to you. Now, we did talk more about tongue ties and tongue exercises in one of my other videos, so I'm putting a link in the description below if you wanna learn more about that. But something you can also try to encourage this proper oral posture and this nose breathing is breathing through your nose at nighttime. Now, you might wonder, how can I possibly control how I'm breathing when I'm sleeping? Well, there's going to be two things I'm going to recommend. One is a mouth tape. So the mouth tape that I like is something called 3M micropore paper tape, which is literally just this medical grade tape you can get from Amazon. All you do is rip a piece off and tape it over your lips. And then the second thing is a nasal dilator. So you can get a nasal dilator strip from Amazon, again, very simple, and it's just a piece of tape that goes over your nose. There's also an internal nasal dilator you can try. For example, this brand called Mute, also available on Amazon, that is more of an internal dilator. So it'll basically be this clip that goes on the inside of your nose and you can kind of crank it open a little bit. Combining one of these mouth tapes plus a nasal dilator will really help encourage you to only breathe through your nose all night long. And this is also how you can help transition you or someone else from a mouth breather to become a nose breather. And again, these are really good for either adults or children. Now, here's another study just to show the importance of breathing through your nose versus breathing through your mouth. So this study had people switch to becoming mouth breathers in their sleep. They found that their sleep quality went way down, and people went from not having sleep apnea at all to having very severe sleep apnea all of a sudden. Now, another thing you can encourage your child to do to help with their jaw development is encourage them to chew their food very thoroughly. Don't just chew a few times and then swallow. Make sure they chew 15, 20, 30 times and chew evenly on both the left and right side of their mouth. And also make sure they're chewing with their mouth closed and sitting with a proper posture. Now, that being said, you could be doing all of these things, but still have to take your kid to an orthodontist to help make sure their teeth are straight and their jaw is developing normally. Because no matter what changes we make now, we're not going to be having the same diet and lifestyle that our ancestors did. So it's really almost impossible to make sure we're getting the same level of jaw development we got back then. But you can definitely improve it by doing all of these things that I talked about. But also, if you are going to go to an orthodontist, it's really important to go earlier rather than later. Because if you go at the age of 7 or 8, then your bones are still malleable and you can still do something called expansion, where you put this expander in the roof of your mouth and it helps your jaw expand in the right direction. This is way better than growing up and hitting puberty and then now you're stuck with this narrow jaw and you can't really expand it a whole lot without doing a surgery. If you look at all the developed countries, 2/3 of people are not getting the recommended amount of sleep every night. Now, you might think that you're sleeping enough, but how can you really know that for sure? Because a lot of the signs and symptoms of sleep deprivation are a little hidden, and a lot of people attribute those signs to something else. So today I'm going to go over